Hey everybody, Dr. Becker. In this video, I'd like to walk through with you the SOAP note case studies that we are going to be doing real quick to give you kind of an example of how to do this. And this is going to be an exemplar study, okay? The purpose of the case studies are going to be that you are able to take that information and practice how to write a SOAP note. And so the first three modules, we talk about the history taking of the patient and how you can create a comprehensive exam. But that's also then what you would also use for a SOAP note. And so the SOAP note stands for Subjective, Objective, Assessment, and Plan. And really what that means is that that's a standardized kind of format that people use to write a progress note. You're going to learn this in the reading, but a complete history and physical is like what you'd use when you're admitting patients to the hospital, when you're doing a complete review of their body, their diseases, the whole head-to-toe assessment of that patient. And a focused note or a progress note is where you're allowed to focus it into the issues at hand. And so oftentimes a progress note is the SOAP note format. And that just allows everybody to kind of understand the flow of the note, and it's the progress note in SOAP format. And so the idea being is that the first part is the subjective, the next part is objective, then you make your assessment, and then you make your plan. And so what we're going to do is take clinical scenarios and practice on how to put it together to create a SOAP note. So instead of writing notes about the actual patients you encounter in your clinicals this semester, we're going to do case studies together. In the future, in next courses, as you move forward in diagnosis and management, you're going to have to write SOAP notes about the patients you encounter in clinical, okay? That's a lot, and so this course, we're just practicing and getting you prepared to launch into decision making. So we're going to practice how to do it in SOAP note format and just begin to practice how you put your thoughts together. So as you go in and you're seeing a patient, there's so much stuff going on. You know, they're talking, family's talking, maybe your pager's going off, maybe the nurses are in the room doing something. And so how to do that history taking, and then how to do the physical, and then how to come out of the room and synthesize it, put it all together, and put your thought process and your decision making onto paper is a skill, okay? So what we really want is the focus is to start learning of what belongs in the subjective box, what belongs in the objective box, what belongs under assessment, what belongs under plan, what does that look like? And then also the purpose of the SOAP notes is that how do you begin to guide questions to get the information that you need based on the condition that they present with, okay? So I've created this case study exemplar for you guys to have to kind of figure out how this works, okay? So you're going to get a simple statement. So this one is a 48-year-old female avid runner who presents to your clinic, so like a walk-in clinic, with a complaint of ankle pain on the left ankle for 3 days, okay? So you'll get a little bit of an introduction to the complaint that kind of helps you describe kind of and focus in on what we're talking about, right? So we're talking about the ankle. So you get a little bit of guidance of what you're thinking about the ankle. Okay. So when you're interviewing a patient, what you're going to learn is that everybody gets like the onset, location, duration, tell me about it, general questions. So whether you come in with a fever or you come in with ankle pain, we're going to say, when did your symptoms start? How long have you had your symptoms? Is there anything that has made your symptoms better or made your symptoms worse? Whether or not it's fever or ankle pain, you have those standardized questions to kind of start to characterize the symptoms, okay? But if someone comes in with an ankle pain, I'm not going to ask them, have you been around anybody else who's been sick, right? Because that has nothing to do with their ankle. But if they came into us with a fever, I would ask certain questions specific to that complaint. So what we want to practice is knowing what you have as the complaint, how do we ask what we call directed questions that are necessary for that complaint, okay? So everybody's going to get the when did it start, what have you done to make it better, what have you done to make it worse? Everybody's going to get those questions. But then we need to be able to direct their questions, okay? So we have a runner, she's female, she's 48 years old, she's having this ankle pain. You get a little bit of details about pain, and it's just to kind of help put your thoughts in order. Okay, so now we want to go to the symptomology. So as the APRN, you would ask the following characteristics using open-ended questions, right? When did it start? How long has it been going on? Is it getting better? Is it getting worse? Where is it located? Does it radiate? Quality, timing, severity, etc., right? So you're going to ask those questions that are standard, whether it's fever or ankle pain. Okay, so after you get those basic questions, it's important then to elicit specific questions related to the complaint. So now we want you guys to start thinking, okay, what else would I need to know? What other questions would I want? And so you're going to have the first question is list 6 directed questions that you would specifically ask for this patient. You have to put 6 down, but you can list more, okay? So I don't want the question to be, how long have you had this pain, right? Because the how long would be of any symptom, any complaint. What kind of questions are you formulating in your head that you would ask someone with ankle pain, okay? Those are the questions I want you to come up with and think about and create an answer to question 1. So your SOAP note would be question 1. We're not actually necessarily writing it out as a true SOAP note, but we're practicing the components of the SOAP note for the case study. So when you're going to be writing the SOAP note, you need more subjective detail. What are you going to ask as directed questions in this interview of a patient with ankle pain? Okay, here's some of them that we would ask. Where is the site of the most significant pain? Do you have other injured areas? Did you fall and hurt anywhere else? How long has it been? Have you ever injured this area before? Can you put weight on it? Do you have numbness or tingling? Do you have any history of this before? Do you smoke? What is your weight? Do you have diabetes? Do you take chronic steroids, right? So these are just some ideas of questions that you would start maybe in your mind that you're thinking. So when you get the question 1, please list 6 directed questions. This is what I'm looking for. You write out questions that you are going to ask, okay, that are specific to this injury. Like we could come up with 40 ways to word questions in this, right? So there's no wrong, really. It's you. I want you guys to be practicing with your thinking, right? Okay, my mind's beginning, my wheels are turning. What am I thinking I need to know about ankle pain, okay? Then it goes into question 2. Other than vital signs, please list at least 10 physical exam components you were unsure were done for this patient. Because she has ankle pain, I'm going to make sure I'm doing these 10 physical exam components, okay? So these are some examples. Like this is not for this patient, but liver palpation or, specific things you're doing. So an answer to this might be these. You're inspecting the ankle, looking for swelling, deformity, etc. So I don't want just inspect the ankle. I want inspect the ankle looking for blah, blah, blah. I'm going to test range of motion. I'm going to test for joint stability. I'm going to test for dorsalis pedis and posterior tibialis pulses. I'm going to test the capillary refill, right? So these are specific things. Again, if someone was here for a fever, I'm not going to make sure that I test the ankle range of motion for a fever necessarily. That's not going to be the first thing that comes to our mind, right? Things that are focused on this patient specific to this complaint. So we've come up with directed questions we're going to ask. And then when we're thinking, okay, I need to examine this patient, I want you to come up with in your mind, what are the things I really need to make sure I'm looking for, right? So for this, I wouldn't necessarily put listen to heart sounds unless you have some kind of rationale of what you're looking for really, okay? So again, we could come up with a whole bunch of ways to answer this question. I'm asking for you guys to put your thinking hat on and come up with, when you're beginning to think, I have to examine an ankle that was injured running, what things am I looking at? You could also say, I'm going to test range of motion of the hip and the knee because those are distal joints. I'm going to, watch her. I'm going to inspect her gait and how she tries to walk across the room. I'm going to test for palpating each individual toe or whatever you're going to do. Okay, you're going to come up with 10 things. Okay. Then we go into part 2. So we've come up with the questions you need to ask and the ways you're going to examine this patient specifically. So that's you. That's you practicing in your brain how you're going to do an interview or an exam with a patient with this complaint. Okay, so we've done the subjective and objective parts, so to speak. We've figured out what we're going to do to get the information for subjective and to get the information for objective. So the next part of practicing what it would be in a SOAP note is the assessment and the plan. Again, you guys haven't learned all this yet. That's okay. That's what comes in the next semesters. But part 2 is after identifying your pertinent directed questions and thinking through your physical exam components, we're going to move on. We're going to pretend now that we have interviewed the patient and these are the patient responses, okay? So someone said, can you describe what happened when you were injured? And they say, I was stepping off of the curb and I twisted my ankle. Was there pain right away? Yes, there was. It really hurt. How long did the pain last? Well, it's still hurting. It's about a 2 or a 3 right now. Did you have immediate swelling? Were you able to walk? Do you have pain now when you walk on it? Is there any weakness? Was there any numbness? Okay, so you guys read through this. This is your example. Like, this is what, if you went in and you asked these questions, these are the responses you had. And then you get the physical exam, okay? So you're going to do that. I'm going to provide you the vital signs. So the nurse has already got those for you. So you know this was this female runner with ankle pain. These are her vital signs. So the next question becomes 3. After reviewing the above information, practice writing a SOAP note for this patient as though you are encountering this patient in an emergency room. You can create whatever physical exam findings you feel would be possibly seen based on the information above. For the assessment part, list 3 differential diagnoses. Remember, your differential diagnoses should be based on the subjective, objective, and your documented physical findings, okay? For the plan part, list any further diagnostics or testing you would order, any interventions, both farm and non-farm, that you would prescribe, and anything else that might be a pertinent part of the plan, okay? So for question 3, this is what you would write in highlighted area. S, subjective. Patient reports, this is an example of what you could say. Okay, reports pain of the left ankle present for 3 days. The pain is rated 5 out of 10. She injured this while running. There is no joint instability. She has never injured this ankle before. She denies any family history of arthritis. She denies any weakness or numbness. She reports swelling immediately after the injury. She has used ice packs and elevation and swelling did improve. She reports she cannot bear weight without pain, and she denies any other injury with this fall. Okay, so I added my vital signs here, and now I'm going to make up what I think her exam is going to look like. Okay, a focused exam of the things I wanted to examine. So if you felt like there was a reason you needed to do the abdominal exam, then okay, write what you think that could look like. So general appearance, a 48-year-old female with a body mass index of 25, no apparent distress, ambulating into the exam room with a limp and from an inversion injury. Lateral ankle anterior talofibular tenderness to palpation, but no pain to posterior edge of medial or lateral malleolus, and no midfoot pain. Positive swelling present, negative anterior drawer test, talar tilt was negative. Skin, ecchymosis of the left ankle skin is warm, dry, and intact with no injuries or something. Extremities, the left ankle distant perfusion is intact with 2+ pedal pulses noted. Okay. So you create what you think her exam could look like. You may also say that all of these are awful, right? She has severe tenderness to palpation of the lateral ankle anterior talofibular area. She has severe pain to the posterior edge of the medial malleolus, and she has moderate pain in the midfoot area. She also has pain with palpation of her left toe. Whatever you want to say that you think is going to come up with, you put on here. You're just practicing how to say it. You're practicing how to write pertinent positives and pertinent negatives. Again, like the specific test that you would do for this type of injury, you need to say that you did it and whether or not it was negative. So even though it was negative, you still document that you did that test and it was negative, okay? And then for your A, you come up with differentials, okay? Again, here, this is what I want you guys to hear. This is you learning, okay? So if you have a reason for this, that you think, put it on here, okay? I don't expect you to be perfect at this. I don't even expect you to get it all right. I'm just asking you to begin to think this way, okay? Do your best with what we know. Do not spend 18 hours on this reading 18 different books trying to figure out exactly what to say here. Do your best with what you've read, okay? So we came up with a fracture of the ankle, a sprain of the ankle, or Achilles tendonitis, okay? Those are the things I'm thinking of that could be possible. Okay, these are not the for sure. These are in your differentials. These are considerations. Okay, And then my P would be, I'm going to order an ankle series, order a foot series. I could consider an MRI if the above is negative and the pain persists. I am going to prescribe ibuprofen. I'm going to consider ankle support or wrap, whatever your plan is. You've now written notes. So this is your practice of writing a SOAP note, S, O, A, and P, okay? So everybody's notes are going to look different. Nobody's note based on this above information up there is going to look the same. All the notes are going to be different, and that's okay. This is about you beginning to practice thinking. This is what this assignment is and how to document that, okay? Then you're going to go to question 4. Provide rationale for your 3 differential diagnosis and for your items listed in your plan using your APA reference, okay? So then you're going to write question 4, question 1, question 2. This is what it would look like at the very end, all put together. So this is what you would submit to me. Question 1, boom. Question 2, boom. Question 3, my SOAP note. And then question 4, possibly it would look like this. The sprain or contusion is a possibility, as partial tearing or injury to a ligament can cause moderate to severe pain, swelling, and trouble walking. XYZ citation. Ankle series would be indicated because of the complaint of pain and inability to bear weight, and I got that from XYZ. And it's fine to get them all from your book. That's fine. If you go on to UpToDate and that's where you found that, that's fine. I don't need 3 different resources. If all of them are your book, that's great. I just need you to explain to me why you answered what you answered. Okay, so when you turn it in to me, it's going to look like this from here down, like your name, Sarah Becker, question 1, write all your answers. Question 2, write it out. Question 3, write out the practice SOAP note. Question 4 is where you're going to explain the rationale for your interventions and for your differentials, and that's what you submit to me, okay? And then maybe next week, when you do another case study, the complaint may be a 48-year-old who has a fever, and we're going to go through that all over again. You would go through and you would come up with, after you asked them all of the basic questions up here, list 6 questions that you would ask for a patient with a fever, and now you're going to write 6 questions. And then you're going to think about, I'm going to list 10 exam components I want to make sure I assess with somebody with a fever. And then you're going to come up with practicing writing a SOAP note, right? And you're going to practice that, and you're going to be able to create whatever physical exam you want based on your reading. Make them really sick, make them not very sick, whatever you want to do, so long as this makes sense of why you're putting what you're putting, okay? Then you come up with differentials in your plan. Again, do your best. I don't expect you to be perfect. I don't expect you to read 6 hours on what an ankle injury looks like, right? We're not learning that. We're not into decision. I want you to read what you've read in your book when you talked about the ankle, take your information, make a differential, and then do a plan, okay? These are simple, straightforward progress notes. These are not meant to be something you're spending hours upon hours upon hours, okay? I'm not looking for perfection. I'm looking for thinking, that you had a reason to say that, and just beginning to practice synthesizing this information and putting it all together, and then you turn it in how it looks, okay? So this is an example of how you're going to do your SOAP notes in your case studies. There's a rubric attached to every case study, okay? And this is how you're graded. The subjective, whether or not you're able to do that. Your objective, right? Were you able to list the 10 targeted physical exam components? Your differentials, did you come up with 3 that are supported and written well? Your evidence-based rationale for your differentials, and then your appropriateness of your test. Do you have a true reason and purpose for the test you suggested? And did you give me the rationale for that? And then your treatment plan, how thorough was it? Did you do it? And then whether or not you made a professional presentation and whether or not you were able to adhere to the SOAP note structure on that question 3. They're all worth 27. I'll grade it accordingly. Nothing about this, you guys, is that I want them to be perfect, like you're ready to graduate tomorrow, right? By the end of your program, if I gave you a case study like this, you'll whip through it in no time at all, and you'll be very in-depth, and you'll know a lot of stuff. You aren't there yet. You haven't learned it. This is practicing it, okay? So this is helpful that we begin to practice how to think about things. I don't need you to write SOAP notes from patients that you actually encounter in your clinical. The only thing that you do from clinical is you get into Typhon and you put in all the details that Typhon asks for to log a patient, right? So go ahead and go into Typhon and look to see what you need to know. You have to know like age, sex, gender, whether or not they had insurance, what their ultimate diagnosis was that you saw, and then a couple other details like that. That just has to log into Typhon to show what type of patient you saw. That's all you have to do from your clinical. We're never going to take an actual patient and practice it in SOAP notes yet. That's what you'll do in the next semester. So when it comes to week 4, maybe watch this video again. Don't panic about it now if it doesn't make a lot of sense because you haven't learned it yet. But I want you to have this opportunity to refer back to this exemplar, and I've posted the exemplar in the course as well.